very informative session planned for you today with two amazing subject matter experts, which will share information we are sure that you will find very valuable. My name is Brenda Cruz Cotton, and I will be today's moderator. I am a manager at Proceed NASA, and I'm also accompanied by my coworker, Joanna Zabo, who is a program coordinator at Proceed's National Center for Training, Support, and Technical Assistance, and she will be handling the comment box for us today. So any messages or comments that you see coming from Proceed NASA, that's who's behind those keys, is my coworker, Joanna Zabo. So as I said, we have a very informative session, and we also have a full house. Already at this time, I already see 88 people that are fully prepared to listen to our presentation today. So we're just going to keep it moving and get started. Okay. We are so pleased to have Ms. Ariana Lintz from Ariana Center in Florida and Mr. Gary Paul Wright from the African American Office of Gay Concerns in New Jersey. You will be listening to their presentation shortly. You will also have time to ask them questions directly. But before we dive into today's topic, let's go over a couple of items, some housekeeping items. Here are our webinar participant guidelines. Basically, we're going to keep all of your lines on mute. As I just mentioned earlier, the session is being recorded and will be available upon request. Questions will be answered during the presentation. We have a couple of question and answer periods, and also a question and answer period at the end of the session. And we want to encourage you to use the comment box or the chat box to make any comments or to type in your questions so that you don't forget them, and to interact with each other as well. So we strongly encourage you to use the chat box. This webinar is being offered to you by our CBER for Health Equity program, which is our CDC-funded program that provides training and technical assistance to community-based organizations across the United States to increase health equity. This is our program's hashtag, Proceed CBER for Equity, and please feel free to use it and engage with us on social media. We also want to, before we get to know the speakers, we also want to know a little bit more about you. Therefore, please respond to these poll questions before we delve into the contents of today. I'm going to be launching a couple of polls, 3 polls to be exact, and you will respond directly on your screen. So let's begin with these polls. Okay, please answer this first question about what region of the United States you are connecting with us today. And of course, if you want to type it in the chat box, please feel free, as some of you are already doing. I'm going to give you 2 more seconds, and then I'm going to share the results. Okay, as you can see here, it looks like most of you are joining us from the Northeast. We have a couple of individuals from the Midwest. We have a large portion of you are from the South and the Northeast. And then, of course, our friends in the Caribbean, Puerto Rico and the Virgin Islands. Thank you so much for joining. Let's move on to our second poll question. Here it is, which please tell us what type of organization is the organization that you represent. You make your selection right on the screen to select the best choice, the choice that applies to you. And so far, I can tell there is a lot of community-based organizations, but yes, please type in the chat box as well if none of these fit, or if you're clicking the other box, the other option. Okay, I'm going to give you 2 seconds. And I'm going to close. Okay, so almost 60% of you represent community-based organizations. We do have some government agencies, federal, state, and local, several healthcare clinics. I see here universities. You see what else you all typed in the chat box. Let me take a quick look. University, a state agency, government, community-based organization. Yes. Thank you so much. University Research Center, nonprofit shelter, community-based. Thank you so much. It's really important for us to know who is participating in these sessions. Okay, so now we're going to go to the third poll, and then we're going to proceed with the presentation. And here we want to learn about your role within your organization. Are you in leadership, middle management, a frontline staff person providing clinical or otherwise, or conducting outreach, a tester? And if you select other, please type in the chat box so that we'll know exactly. Give you a couple of seconds. Okay, 2 more seconds. Triage coordinator, frontline educator. Thank you for being very specific. Health educator. Okay, I'm going to close and let's take a look. Here we go. So 41% of you are frontline staff members that are outreach specialists or testers. We have 19% in leadership, 18% middle management, 10% clinicians, and then we have 13% in others, in the other category. And that includes community health workers, health educators, triage coordinator, frontline case manager, coordinator, registered nurse, HIV counselor, phlebotomist, AmeriCorps member, frontline, yes, physician's assistant, leadership, coordinator. This is all great. This information that we're going to share with you today is applicable to all levels within an organization. Okay, thank you so much for participating. So now we're going to move on, and these are today's program session objectives. We will describe barriers faced by transgender persons in accessing healthcare and social services with the resulting health disparities. We're going to highlight key criteria that can be used to identify transgender competence service providers. We're going to discuss tools, instruments, methods that can be used to evaluate transgender competence in an organization. And we have a lot of, just 1 second, okay. Okay, we have a lot of instruments that we're going to share. And we're going to identify changes in an organization, changes that an organization can make to provide responsive, affirming, and welcoming health and social services for the transgender population. I'm hoping that everybody could see the slide where it says program objectives right now. If you can type in yes in your chat box, that would be great. Okay, so here is the session agenda. How we will accomplish the objectives that I just discussed is through the topics on this agenda. So I want you to just take a quick moment to review it, and then we're going to introduce our first speaker. Okay, I'm very excited, and I hope you will all join me in welcoming Miss Ariana Lynch. Before I read her biography, I'm just going to open up Miss Ariana's line. Okay, Ariana, I believe you're self-muted, so there we go. Thank you. Ariana
Hello,
Lynch is
hello.
the founder. Hi, Ariana. I'm going to read your bio, and then I'm going to turn it over to you, okay?
Sure.
Okay, thank you. Ms. Ariana Lynch is the founder and CEO of Ariana Center, an organization dedicated to providing direct services, including HIV testing and linkage to care and prevention in South Florida and Puerto Rico. Ariana is a passionate trans educator and advocate, originally from Peru, where she graduated from law school. Ariana is currently the head of the South Florida chapter of the Trans Latina Coalition, chair of Flux Puerto Rico, and the 2020 chair of the Human Rights Campaign's Elevate or Elevate program. Most recently, Ariana was a recipient of the 2019 Robert Wood Johnson Health Equity Award. Please join me in welcoming Ms. Ariana Lynch, who is our first speaker today. Ariana, I will let you begin.
Thank you. Thank you so much, Joanna. Thank you so much, Christina, all the people from the National Center for Training, Support, and Technical Assistance. I'm very proud. I'm very happy to be part of the faculty today. Um, I am say hello from the beautiful island Puerto Rico. We are right now in Puerto Rico in Rio Piedras, doing some work and specific for transgender community in Puerto Rico. Um, like I told you when they invite me to make this training was very passion for me, because all the time when we make face-to-face training is different to doing a virtual training, right? Usually when I'm start my training, I ask to the people, especially case manager, outreach, or front people from the agencies, if they can switch your shoes, put the right shoes and your left feet, and your left shoes and the right feet. But if you cannot do it today, no problem. But let me tell you, so you can see how uncomfortable for many years transgender can work and can be developing in the community, but you can feel that sensation transgender has, like you have in the wrong fee of the food, right? So Ariana Center provide direct services for transgender and non-conforming community, primary trans women of color. We offer HIV testing along with linkage to care and prevention, post-incarceration support services, including emergency safe housing, linkage to mental health services, what is crucial for the community. Assistance with name and gender marker changes. That is one of the, for case manager, we are, we add this part in the case manager specific for in the HIV field. The case manager can helping transgender to get the gender marker and the name change. Some part of the region, some regions in the United States, Ryan White services part A cover legal services. Some other regions no, but it's the ways you can find how you can change your name to your client when the client is transgender and they don't show they don't match the IDs, right? Also enroll to the GED classes and the English for second language classes. And we have advocate programs for clients living with HIV. I am head of one organization, but also I am a trans Latina woman openly living with HIV. And HIV for many of the people, they give a sentence of life for many people, but for me was like the trampoline to get a decent job. HIV field is one of the of the more llamative and more for transgender is more we need a more transgender in the HIV field. So it's very important, right? So that is what I'm very open about my status, but also I know how dangerous and how difficult it is for many transgender who maybe they don't have my privilege right now or my care, medical care, but the stigma, specifically in the South and in the transgender community in HIV, is terrible. So that's what I do in my job. I put the face of the HIV and I try to break the stigma for transgender women living with HIV, and that's what I put my face there. Our services provide in South Florida, specifically in Fort Lauderdale, Miami area, West Palm Beach, and also Puerto Rico. Transgender individual, particularly uh, among the most marginalized communities. We experience discrimination, access services, and high rates in the general population and disproportionately affecting by the HIV. For many of us, I am ambassador, you equal you ambassador, but for many transgender living with HIV, we are still in the 80s and the 90s fighting for people. And this time, many people they can have live healthy lives living with HIV. For transgender, is very difficult, and you can see transgender all the time coming with high viral loads or without the care. So that is very important. Next slide, please. Um, we are Ariana Center in South Florida, partner with other amazing agencies, and we try to have a data specific in our regions, right? Because for many, transgender don't have national data, and that is what we bring us to Puerto Rico right now. We trying to create a first transgender need assessment in Puerto Rico, but in Miami or in South Florida, we already did this data, partner with the Human Rights Watch or partner with Positively Trans or with the Well Project. And this is one of the data what we have. 4 times more likely to live in poverty, 90% experience discrimination in the workplace. Thanks God, yesterday was amazing day and glorious day for the transgender and for the LGBT community, where the Supreme Court give us to the whole transgender, gay, lesbian, and bisexual the same rights to any other employer in the United States. And this is a huge impact. They're going to make a huge impact for the transgender community specifically. One of the three high points for the transgender community, high needs in the transgender community in South Florida is unemployment. For transgender and non-conforming people of color, is 4 times more of the national average, and many living without insurance. And that is very, for many of transgender, the only option if they are living with HIV is Ryan and White. And if they don't have or they don't living with HIV, be uninsured is one of the options. So that PrEP is very inaccessible for transgender individual, specific if you don't provide or create one specific program with this social distance for transgender individual in your area or in your organizations. Next slide, please.
Okay, so
Cool.
at this point, I'm just going to take a moment and I'm going to launch 2 polls that we want you to respond to. We want you to be engaged and participate in the discussion. So I'm going to go ahead and launch the first poll. The next poll. Okay. And this poll, please respond, is about the rate of HIV diagnosis for transgender women of color. I'm going to close it in about 2 more seconds, so please make your selection. I can hear people thinking. Okay, I'm going to close it, and we're going to share the results. Here we go. 68% of those that responded believed that the rate of HIV diagnosis for transgender women of color is 14%, followed by 28% said it was 8%, and 4% said it was 2%. Ariana, would you like to comment?
Yes, of course. This is based on the data what we have, but that is a specific, very important for people who is in the outreach or in the people who they make a HIV testing or for HIV testers. It's very important to start thinking and start programs for transgender individuals. How? Hiring transgender testing. Maybe give in Ariana Center we do in Diana project, where is one project what we are going to where the transgender is. If they are in the hotels, we go and make a testing in the hotel and we provide services. Of course, with the COVID-19, we have some regulation, but it's very important to start getting important of testing for the HIV community, for the transgender community, so you can have a more data. And also the April 18 every year is the National HIV Testing Day for transgender. So just remind them for those who they working in agencies, they can remember this very important day for the transgender community and the HIV testing.
Thank you, Ariana. So please share with us which is the correct, which is the response to this question?
The 14%, 68% of the audience is correct.
14% is the rate of HIV diagnosis. Okay. All right. Let's go to the next. One more poll question, and then we're going to continue with Ariana's presentation. Here we go. The true or false question. And just 2 more seconds. Okay, I'm going to close the poll and share the results. So what do you think, Ariana?
Unfortunately, 76% of the audience of the people in this training have the correct answer. 44, maybe more, but and the data 44 is the percent of among HIV among Black transgender women in United States.
Okay, thank you so much. Let's go ahead and return to our presentation. Okay, Ariana, continue, please.
Yes, sure. So now what we're going to talking about the health disparities, what is very important. Fear of discrimination led to 1 in 5 transgender people seeking healthcare. In South Florida, this rate to almost 1 in 3. 29% of transgender people have to educate their healthcare providers about transgender health, and that is very unfortunate, right? Because many of the transgender, we prefer go and get hormones or different medication at the street because we don't believe or we don't have a comfort when the healthcare provider. So that is very important. In South Florida, this rate is up to 50%. Next slide, please.
Sure.
And this data is according with the Fenway Health Center. 62% experience depression. That is huge important and focus and mental health for transgender. That is one of the bigger issues and detox program. There's very important. 41% attempting suicides, 26% experience drugs and alcohol issues, and 30% smoke. Rates of the HIV among transgender and non-conforming population overall are 3 times the national average, with 14 of the transgender women living with HIV. 44% Black African American, 27% Latin or Latinx, 7% of white, and half of those diagnostics living in the South. So that is very important for me, provide this training, and specific, very happy to see a lot of people from the South and the Caribbean, because this kind of training, they can help you to together get more prevention and more HIV care for transgender. Next slide, please. More of the data of the report, what we have. This is one of the Ariana Center Need Assessment and the Transgender Law Center. We make it together, 31%. And this is specific for transgender living with HIV in the South Florida. 31% report begin refuse care by provider because of the gender identity. 20% report begin refuse care by the provider because the HIV status. 41% have gone over 6 months without care since the HIV diagnostic. The gap in care raises to 51% for those who they are historic of the incarceration. Gaps in care and higher for those who experience provider discrimination. Clients report begin misgender, and this is one misgender is one of the key points for you can have access to the transgender community. It's few kids, few cases, but misgendering or the gender is important. If you see one transgender who even in the IDs matches with the legal name as a male, but you can see she approached the social as a woman, you have to treat it as like one she wants, because if you lose one transgender, you're going to lose 50 transgender in your clinic or in your organization. And this is what we don't want. We want to bring more people in care and more people get tested. That is very important for the front desk. The front desk, the girls, the people who they are the first touch base with the transgender client is a key, is crucial for developing good care for transgender individual. Lack of access and gender affirming hormones therapy. Next slide, please.
Okay.
I'm sorry. Health priorities, gender affirmative and no discriminatory health care. We are 59%. Many of the transgender, we don't want to go to a clinic to get HIV care. Many of us, yes, HIV care is concerning, but it's not a priority when you are a transgender individual who they don't have a hormones or they don't have or they don't start the transition. So if you have a client and you offer hormones therapy complementary with the HIV care, you're going to have a client every 3 months in your clinic. That is very important. Gender affirming and non-discriminatory healthcare. Hormone therapy, slight effect 53%. Mental health, including trauma recovery, 49%. Personal care, such as a nutrition and healthy living, is 47%. Antiviral therapy and a side effects is 46%. Next slide, please. So gaps in care. Oops. Yes, gaps in care. Having a provider that has the same living experience as a client help create a sense of understanding and trust with a clients. Our studies showing the provider offering services for trans community have relative low number of transgender and no-binary people in staff, and that is very important. Case manager, management and leadership. We don't want to you hire me just to be outreach. You know, I am a CEO of one organization, and I think we have a talent as an employees, and we have to be involved in all levels of your organization. You not just you not just hire a transgender employer for a transgender program. You can hire a transgender people from front desk, and you can change totally the vision of your clinic or your organization. So that is very important. The receptions, 16%. And you can see no more nice people in reception as a transgender people. Health provider, 9%. Unfortunately, we don't have too much access to education. So we are behind in education sometimes, and we need it. For case manager, many organizations, they request bachelor degree specific. In my organization for transgender case manager, we needed a transgender woman of color or transgender people of color who they pass some experience, because that experience no in any faculty or any university going to give you the access to a transgender individuals. The key to what a transgender people have with other transgender people is very important, and it's a unique. So that is one of the other comments. Next slide, please. Specific in healthcare provider, 9%. I see people from Puerto Rico. In Puerto Rico, I noticed a lot of transgender individuals. They are nurses. They are registered nurses, or they are assistant nurses. And it's very important if you can start hiring a transgender in the medical staff. Also, you can change the vision of the clients when they visiting. And Ariana Center, all of our case manager are transgender woman of color or gender non conforming. Some have experience in sex working, incarceration, and living with HIV. All these three identities, I got it. I have. So I used to have a sex worker in New York before. Then I have incarceration in Jacksonville, and openly living with HIV. And now I have my organization who provides services for more of 350 transgender and non-conforming people in South Florida. And we make huge impact in Puerto Rico in the only 6 months we are here. Their living experience, vital, and creating trust with the client. That is the main of this training. More of the academic things and everything is the trust. The transgender individuals is a people who a lot of people validate her system. They don't helping. So we need a trust in somebody. If somebody tell us trust in that person or in that organization, we're going to be there. But if we see we don't have, and they promise something what we don't have, that is other issue, and they can be a confrontation or when the transgender. But it's very important, like I tell you, you have the sensibility for a transgender individual. Next slide, please. Offering competency training with local providers, including frontline staff, such as reception, check-in staff. That is very important. That is one of the main and the expertise of transgender individual, because when we do it face-to-face, we try to do exercise and change roles, and doing this kind of exercise like switching your shoes so you can feel the uncomfortable, or make in 5 seconds write your name, and in other 5 seconds write your same name with the other hands, because many of the people, they say, how you know you are transgender? How you know? So people say, oh, how you know? Okay, how you know you are right-handed, or how you know you are left-handed? Write your name in 5 seconds. People are going to write your name in less of 5 seconds, right? With the correct hand. But if you can ask with the same time, write your name on the other hand, you cannot do it because you figure out you are handed or you are a left-handed in your life. So that is one of the very important one-on-one meeting provided with the leadership. That is other important things, and collaboration with providers. Nothing over here, nobody can stop the HIV in the 2030 if they don't going to working with the transgender community. And this is very important. So if you working in the HIV field and you maybe don't respect transgender community, but you don't care or it's not your priority, if you want to stop the HIV in 2030, in some way, you have to work with the transgender community. Next slide. Identify a trans competitor provider. Has the provider complementing any transgender competence training and your duties? Does the provider require all staff under transgender competence in training? Does the provider center leadership for transgender and non-conforming people? And it's very important when you hire or when you want to have a transgender sensibility training specific for your community. Very important, if one of the staff or one of the trainees is openly HIV positive or living in the South or is as an ex-sex worker or former sex worker, because that experience you have to know for treat clients and the help later. Is the provider know your community for transgender competent care? Check with other organizations in your area if they are experienced with transgender. Meet person with leaderships. Seek feedback from referral clients to continue access to providers. Next slide, please.
Okay, thank you. So we are going to go ahead. Let me just see something here. Okay. Give me just 1 second. Just want to make sure that everybody can hear me. Just type yes. Okay, great. So yes, so we are now going to move along and we'll give you the opportunity to ask Ms. Ariana Lynch your questions. And I did see some questions, some people type in some questions in the chat box. So we're gonna go ahead and start to address those questions. So I'm sorry, there is no sound. 1 second. Okay, I just want to check again. Yes, okay. So I'm so sorry. It seems like we're having a little bit, some people can hear me and some people can't. I'm not sure what is happening there. I am really sorry. But we're going, right now, we're going to do the frequently asked questions. And why don't we go ahead, since I know that already so at least 1 or 2 of you have typed in your questions. So we're going to take those questions. And then we're going to also jump in and do some frequently asked questions as well. So here we have someone that stated, Rwanda Gross stated, had no idea the statistics were so high, the statistics that you reviewed before, Ariana. What more can we do? Transgender men are not discussed. So we're going to be talking about transgender men as well. But right now, what more can we do in terms of trying to change the course of these statistics, some of which you shared earlier, Ariana?
Well, it's very important to innovate new. I think this moment of the COVID-19, you heard me, right?
Yes, I can hear you.
Hello. Okay.
Yes, I can hear you, Ariana.
So it's very important to this time and the COVID-19, give to the agencies or some employees to innovate new ways to go to clients and people, right? So this is the same way, yeah, like you can work with the transgender community. Innovate. If your HIV testing or you outreach for many years don't bring transgender, and you want to work with a transgender, try to innovate one program for transgender, maybe hire one outreach programming for transgender or start a project where you can get opportunity, because one of the transgender community, even living with HIV, not living with HIV, with high education or with less education, we just need in the whole United States or in the whole world is just opportunity. When I'm becoming HIV positive, I want to be a client and just be in the clinic for care and living. But when somebody in that clinic give me the opportunity to work as a peer, change completely my life. And that is what you have to do something, trying to working. If you don't have experience or you don't feel comfortable, call us. Call expertise transgender agencies like us or other agencies around the nation, or contact this organization who provide these kind of trainings and ask for advice or working. And we are very happy to help you to have more. This data is just for us. But imagine when CDC can parking, well, CDC this year start giving data for transgender individuals. But when we make a very, very good data, the number they can change huge. They can be a huge change. So only is trying to helping with new ways and new opportunity for transgender individuals.
Thank you, Ariana. Okay, so the next, I'm going to take one of our frequently asked questions, and it reads, transgender women are often unable to access health care that they need and face anti-trans violence in their home countries. What are some of the unique challenges that these trans immigrants face, especially those who have experienced ICE detention? Diana?
Yes, well, it's very important to health health departments and agencies who they work with, um, ICE and detention center, who may sometimes they are private detention centers, but some detention center working when transgender community. And the last year, two transgender was living with HIV, died in hands of the immigration people in those institutions. So it's very important to helping transgender individuals who they are immigrants and they are coming for new opportunities, right? And our countries, specific in El Salvador, specific in Brazil and Mexico, where transgender just be diet just because they walking on the street. And and this is what the trans immigrants faces when they come into United States. Also, when they release the ICE detention center, is very important to get this transgender individual in care and connecting with the resources and helping navigate easy and smoothly in the right and white system.
Okay, thank you, Ariana. I'm going to take one more question from the audience, and I just want to state that after our next speaker, we will have another opportunity at the end of the session to ask Ariana some more questions. But Ariana, so someone put in the chat box, have you reached out to some of the South Florida medical schools, such as the University of Miami, to see if transgender healthcare can be incorporated into the training of medical students, if not already being done?
I trying to. For many years, I trying to helping. Actually right now in Puerto Rico, we're working with the school of the master school in public health, but medical school, they are very difficult to get in, and we provide training and FAU for nursery school, for nursery school, but medical school is very difficult. I think they have only 4-hour LGBT curriculum, what is very funny because transgender individual need some very more like you can see in the answers, many major of the medical provider learn how treat a transgender individual for the client from the client. So it's very important, and if you have the ways to contact those persons and trying to helping listen, something happened, thanks God you are from South Florida, because something happened in the big cities in United States, Washington, New York, San Francisco, Los Angeles. They have a clinic specific for transgender healthcare, specific. And the mayor of the tourist city, South Florida, the first and the second place in new diagnosis of HIV, they don't have any type specific for transgender individual. And if you, the person who made this question, trying to work with me and help the transgender community, please contact me and we can do something together.
That sounds great. That sounds great. Okay, so Ariana, if you can, Ariana is going to stay with us to the end of the session, and she's going to be able to answer any more questions. And I know that some of you have a couple of questions that we're going to hold a little bit until the end of the session so that we can have an opportunity to welcome our next speaker. So thank you, Ariana. You really provided some important information and very enlightening data that you have compiled. So it is really important that this data, that people listen to this data and get encouraged and motivated to look for data in their own areas and regions, since I know that some of this data is very specific to Florida. But we're going to hold, so I'm going to mute your line, Ariana, and I am going to get ready to introduce and welcome our next speaker for today's session, which is Mr. Gary Paul Wright. So I am going to go ahead and unmute his line so that after I read his biography, he can begin his presentation. So just 1 second. Okay, so Gary Paul, it seems that you have to enter your audio pin into the phone in order for me to be able to unmute your line. So if you go, you should, when you click the audio on the console, you should see the phone number and an audio pin that you would enter into your phone pad, followed by the pound sign. And that way I could be able to unmute your line, because at this moment, I am not able to unmute the line. But perhaps you can do that while I go ahead and read your biography, and then we can get you started. And Gary Paul, your audio pin is 109 pounds. So you would do pound 109 pounds right into your phone, and that would allow me to unmute your line. I'll check back with you in a second. But it sounds like, looks like you're ready.
Hello.
Okay. Yes, thank you. Great. Okay, Gary Paul is ready. But before you start, Gary Paul, I'm going to tell our session participants a little bit more about you. So, Gary Paul Wright is the founder and executive director of the African American Office of Gay Concerns, here located in New Jersey. He is extremely active within the LGBT community in Newark, New Jersey, where he has served 2 3-year terms as a charter member of the City of Newark's Lesbian, Gay, Bisexual, Transgender, and Questioning Mayoral Advisory Commission. He was appointed to the Essex County Executive LGBT Advisory Board in 2011 and is currently serving a 4th 3-year term as well. His agency, which is the African American Office of Gay Concerns, is dedicated to serving as a resource and safe space for the LGBT community in and around the greater Newark, New Jersey area. They are now state approved for HIV rapid testing as a testing site with HIV prevention and intervention programs such as Many Men, Many Voices and SOS Saving Our Sisters, which is formerly Sister T, for young transgender women of color. The AAOGC, as they're also known as, was one of several organizations honored in 2014 by the New Jersey Senate and General Assembly with a joint legislative resolution and was recognized in 2016 by the Newark Municipal City Council on National Transgender HIV Testing Day. And since 2008, AAOGC is also known for spearheading the annual 1 hour of silence to end the silence, a noontime vigil that takes place each year in front of Newark City Hall on World AIDS Day. Please join me in welcoming Mr. Gary Paul Wright.
Hi.
Paul?
Hi, can you hear me now?
Yes, I can.
Hey, great. Okay, well, thank you for that introduction. I didn't realize we did all that stuff, so hey, thank you. And thank you for allowing me to take part in this event. I know the work that you guys do, and I just love you guys, so being an actual presenter with you guys just really made my day. The AAOGC has been around since we actually started in 2002, and it was literally created around my kitchen table when a group of my colleagues and my husband discussed the fact that Black gay men were continually listed as the most at-risk population for HIV in New Jersey. We sort of felt the need to do some specific outreach to this group, something that currently was not being done. I was actually working for the New Jersey AIDS Education and Training Center at that time, and they were good enough to allow me to, try to start this organization while I was still working for them. Now, there were a lot of organizations doing good work, really, so I'm not putting anybody down, but we felt like this problem was one that needed just a little bit more attention. So we put in motion the possibility of starting an organization to correct this disparity and to, rewrite the narrative as it were. So at one point, the New Jersey Department of Health and Human Services got wind of what we were doing, and Steve Saunders, who recently passed away, was in charge of prevention and education, and he actually reached out to us and said that, if we got our act together, maybe the state would throw some funds our way. So with this incentive, we completed all the paperwork and that was required, and we applied for our 501c3 status, which we did obtain. And once this happened, we were on our way, and we were, in fact, the very first gay-specific organization, let alone African-American-led, that the New Jersey Department of Health funded. So when I say we're changing our pronouns, I did leave out one word. There's a typo where it says, like everyone else, we included the transgender. A word missing is population. I apologize in our efforts. My husband generally proofreads all my slide presentations, but he's been doing his own telehealth. He's a nurse, and so I didn't bother him with this one. So anyway, that's why. So let's move on to the next slide. And it was actually this poster that actually changed, that helped us change our tapes and what we were thinking, or what I was thinking about the transgender population. I knew about, I had drag queen friends and things like that, but I really didn't have any transgender friends, so to speak. But we put this poster up in our office, and just to kind of make sure that we were a safe space, because we were having a lot of young people coming in. And this poster, the Bionic Woman Transgender, was actually created out of California. And it says, protect that precious body, use a condom. And it points to the fact that a transgender person may resolve to significant investment in the enhancements of their gender presentation. Now, this particular model, who went by the name of Asia Vitale, which is not her real name, I do know her real name, and she's just a wonderful person, actually never actually had any surgery. So even though you see a price tag on various parts of that body, she's a natural woman and a natural, beautiful woman. So we really thank her. But anyway, we we put this poster up, and within a short span of time when we opened, we began to have a lot of young men coming into our office, and they were like, they felt safe enough that they'd go into our bathrooms and put on their Daisy Dukes and their wigs and run out into the streets of Newark, downtown Newark, and terrorize the area. But we enjoyed having them coming in and out. And we were surprised because we had no idea that many young gay black kids identified with that poster. So, we just let them do what they needed to do. They'd spend their afternoons as girls and then come back into our office, change back into their male drag, and go home. So within a year or two, they actually started coming into the office in drag, and they started referring to themselves as transgender. So this was like something new to us, and we knew we had to do something specifically for them. Next one, please.
Sure.
Okay, thank you. So in 2004, we received those few leftover dollars from the Department of Health, and we were able to start our transgender peer advocacy project. We called it TGIF, or Thank Goodness I'm Fabulous, and we produced our first transgender forum. It was about a dozen male to female transgender women of color attended the event, which eventually led to subsequent forums in the years to come. We thought it was very, very empowering that girls would show up, first of all, and there was actually a gay prom either in Jersey City or Newark that evening, so a lot of them came dressed to kill. But it was a really, really powerful day, and we really knew that we had to do something specific for this crowd. Next slide, please. So what we did was we got some more money from the New Jersey AIDS Partnership and the United Way of Essex and West Hudson counties in an amount of $50,000. And we used that money to really establish the TGIF Peer Advocacy Project. We hired our first trans woman by the name of Jackie Webb, who goes by the name of Jaxie, and she was hired in October 2007. And once we had Jaxie on staff, man, the transgender women really started coming in because it was like, wow, we got somebody working there. And of course, we wanted to start a core because we wanted to do some educating and entertaining at the same time. So we called it Edutainment. And as you can see, that was the first flyer that we actually put out, seeking, girls that would want to become one of the, quote, ginger girls. Now, the reason we called it ginger girls was basically because we put them in lab coats, and they had the updo hairdos and the glasses, and so we based it off of Ginger Grant from Gilligan's Island. So I don't think anybody really minded or cared, but they were the ginger girls, and they were fabulous. Next slide, please. That previous slide, that was Anastasia, ginger girl Anastasia. This is actually on this picture, Jaxie, who was our first trans woman on staff. And the actual debut of the Ginger Girls was at the National Black HIV/AIDS Day observance held by the city of East Orange. And as part of the evening's events, and it was held at City Hall, the girls walked in doing the banana chant and actually did a condom demonstration using a banana. And the mayor at the time wasn't too happy with us because, first of all, we did a condom demonstration with a banana, but the banana we normally use or in rehearsals was a plastic one, which we left back at the office. Luckily, I had a banana that I didn't eat at lunch, so we used that banana, but it was kind of ripe. It was brown, so the mayor kind of got pissed off at us, so he wouldn't speak to me for another year. But he got over it. But as you can see, we also got a lot of press, some press, local press out in Jersey and the Star-Ledger. We were very, very happy about that. Next slide, please. So what we did was we started having weekly or bi-weekly meetings with the girls, and we were doing the intervention Partners in Prevention. We got permission from the state to go ahead and use this. Now, a lot of you aren't familiar with Partners in Prevention. It was an old intervention, 3MV. And basically, we had adapted it to use with our black gay male population. So we tweaked it just a little bit more, and we kind of adapted it for trans women. Now, also during this time, the group began to participate in outreach opportunities. This included house balls. So, like one of the biggest ones was the House of Jordan's stomping at the Savoy Ball, and they worked out, giving out condoms and just HIV information. We also did street outreach in Newark, the area west of near our office called West Kinney and Chestnut Streets, which is basically the Stroll here in Newark. Now, unfortunately, though, a lot of the activities on the Stroll took place during the late night hours, and I did not want to put my girls at risk at all. So soon we just really had to use word of mouth to get the word out that we were doing what we were doing, and so a lot of the sex workers actually began to come to us. Mainly to get free condoms and lubes, but it didn't matter. Just getting them to the house was the major thing. So the next slide just talks about lessons that we have learned in the first year. Now, these are things that we actually came up in-house. We get a lot of help from our State Department health, but these are things that we discovered as a grassroots organization. Number one was having trained facilitators. This is a must when it comes to HIV prevention. Don't take anything for granted. Do your homework. Don't produce false life-saving information. That's wrong. That's wrong. Our illustrious leader does it all the time, and that can kill people. So, have your trained facilitators knowing what they're talking about. Incentives. Boys, incentives are important. This includes food, lunch or whatever time of day you're feeding them, bus tickets, and even a monetary stipend. Now, you have to remember, a lot of these girls, depend on working, the streets at night. So anything that you could do to help them, number one, get out in the daytime, pay them, even if it's a token, $20 or something, but, give them incentives. Now, while the program is focused on HIV prevention, issues such as legal name change, hormone therapy, education, and jobs really, really do play. When we asked the girls, what was important to them, just like Ariana showed earlier, hormones is a big one. It's just HIV prevention, so you have to realize you're going to need a catch to get them into. And timing is a real issue when you're a daytime agency. Your intention and your intended population is geared towards evening hours. So you've got to find a way to compromise. You can't have stuff, events going on at your agency and it starts at 10 o'clock in the morning. The girls work at night, baby. Okay, late afternoon, evening, early evening is the hours that you're going to get these girls in. Next slide, please, and we'll run through these. So, let's see.
Oh, yeah.
Adapting sister. So what happened was we were already thinking about doing sister. Oops, somebody's out there. The decision was made to offer the evidence-based intervention SISTA, which is basically was made to do HIV prevention for heterosexual Black women. It's a peer-led program to prevent HIV infection, and it stands for Sisters Informing Sisters on Topics About AIDS. So we thought, hey, we could try to do this. So the Department of Health allowed us to send two people. One was Carla, who's our office manager as well, and Jaxie to attend SISTA's facilitators training. So doing that, we obtained technical assistance for AAOGC through the CIBA request system, or what's known as CRIS. And through the CRIS, the agency was contacted by the Transitions Project at the Center of Excellence for Transgender Health at the University of California in San Francisco. And next slide, please. I think that'll take us to, yeah. So what happened was they contacted us after they were contacted by the Department of Health, and they sent Luis Gutierrez Mock out to see us, and he worked with us for a couple of weeks. He was a trans man, and they actually just sat us down, and they worked with us, worked with my staff, and they kind of created a worksheet or a implementation plan for us. And they were just really, really wonderful people. And if you get a chance to, interact with these people or anybody at the Center of Excellence for Transgender Health, you will be thoroughly pleased about it, okay? They offer skills building trainings, trans adaptations, implementation of trans adaptations, one-on-one consultations delivered via phone, email, webinars, and materials including guides and things like that. So we really, really love this, and they really did a good job with us. So next slide, please. So what happened was we came up with these steps, and this is just a modified version of what we had to go through. It was like really 4 pages long. But we needed a minimum of 2 staff persons who needed to be trained. We created a community advisory board of trans women. We had to gather baseline data and risk behaviors, risk factors, and cultural characteristics for our community. And remember, this is all local. This is all based on what you have in your particular area. We then identified methods to recruit the population. We finalized all collateral materials, including implementation and planning worksheets. We developed and implemented marketing and recruitment plan. We developed program and monitoring plan to improve the program once it got started to make sure we had quality assurance. We designed evaluation tools, conducted data collection, data analysis and interpretation and reporting, and we requested technical assistance wherever we needed. And once again, we had the blessing of the Department of Health. So you really need to work with your Department of Health wherever you are and your local funders, because somebody's got to fund this stuff. You can't just do it outside, just wave a magic wand and bing, there it goes. So next slide, please. So basically, even though the AAOGC had been submitting transgender-related demographics since 2007, which is when we really began TGIF, the Department of Health was still not producing statistics for trans persons as of yet. So I was also a member of the HPG, and that group formally recognized the trans community as a population of its own that needed to be addressed. And so they were concerned that services to them had consistently been underreported, underfunded, and underdeveloped. So basically, the EHARs, which is basically their reporting technique or whatever you want to call it, was basically, they just said that transgender indicates a discrepancy between sex at birth and current gender identity. And issues in collecting this data, they reported no population estimates for transgender people in the United States exist, so rates cannot be calculated. They also said there were too many small cell sizes, and that the current HIV risk transmission categories were not tailored to transgender persons, meaning like everybody else, they were, putting transgender cases in with the MSM, the men who have sex with men category. And we kept telling them this was not what you need to be doing, y'all. Next slide, please. So finally, I know this one might be hard to read, but finally the state of New Jersey began including transgender data in its EPI reports by 2015. So we were all very, very pleased that they were, number one, taking us seriously, that we identified that this was a separate population, even though on a federal level, they weren't counting these numbers. And eventually, of course, the feds started doing it as well, thanks to advocacy groups throughout the country. But as you can see, New Jersey finally did it based on numbers collected through March 31st, 2014. Yay. Next slide, please. So just going quickly, so we talked about doing seminars and symposiums for this group. Our very first one, besides the initial one, was in February 14th, 2009. And we called it St. Valentine's Day Mascara because it was like a play on words for the St. Valentine's Day Massacre, which, the 14th is St. Valentine's Day, so we were playing on words. Now, unfortunately, none of the young people that came to this knew what the hell the St. Valentine's Day Massacre was. So, they were like, so the joke was kind of lost on them. But they really liked the mascara, and of course, everybody got a mascara in their goodie bags. So we liked the name, so we kept it. So even though the first one was held on Valentine's Day, the next one and thereafter, we actually had them on Transgender Day of Remembrance, which is November the 20th every year, the International Day of Remembrance, International Transgender Day of Remembrance. So we've had it on that day ever since. And at our very last one we had in November, this was our 11th one. So, we had like a dozen people at our first one. We had over 125 attendees at our last one. So we're very, very happy about that. Next slide, please. So basically, we still needed assistance. You get the fact sheets from the government and from USC, CF, and we came up with these 8 best practices. If you want to go to the next page. Okay, so we came up with these, or they came up with these, and we find that these are very, very great practices that for everyone to have in their little toolkit. First one is ground your work in the community. You really need to develop partnerships with trans people and organizations in your community to create and to grow programs and services and research and all this by and for trans people. Like I always say, I am not transgender. I don't speak for the transgender community, but I can speak about our experiences with the trans community. And our experience has been one that we've had to learn. So it's not, we don't teach them, they teach us. Number 2, race and ethnicity. One size does not fit all. Okay, working with gay Black men, a lot of them have trans friends and a lot of them like to come to each other's programs and things like that. But not everything is for everybody. There's specific stuff that trans women need to be specific about, and that's what we try to do. We don't try to mix apples and oranges. HIV risk and issues of stigma and discrimination, they're all specific to trans people differently than they are for gay Black males. Number 3 was utilize multidisciplinary approaches to HIV prevention. Educate and provide services and care through a broader context of health and wellness. Consider approaches that focus not only on the individual, but also on families, social networks, schools, communities, and organizations which transgender people live, work, and play. Number 4, get the facts. Assess, evaluate, and enhance. Conduct through needs assessments and evaluations. Use the data in program planning and improvement, and disseminate what you have learned, which is what we're doing now. Number 5, looking in all the right places. Recruitment and retention strategies should consider the unique needs of circumstances of priority populations. Make an effort to go beyond what is convenient and bring education and services to trans people in their neighborhoods and in their community. Number 6, increase access to health care for trans people. Have a central or a multiple location or with easy access to public transportation. Provide services in multiple languages if you can, and have trained providers who understand current HIV and health care issues of trans people. Provide hormone therapy as part of any primary care if you're clinical. So that's what we do. And when we find out that trans people have not been treated fairly, we don't use those people. We don't recommend them, and we'll put the word out. Don't send anybody to that agency or that department, city department, or whatever it may be. Do your homework again. Number 7, invest in developing and supporting your staff, prioritizing staff development, providing ongoing training and education, and creating opportunities for advancement are key to building capacity, healthy work environments for staff members and their clients, and if you have patients, your patients. And finally, number 8, advocates for structural and systemic change on behalf of trans people. Collaborate with community partners to advocate for policy development and social change to identify and address how HIV among trans people is impacted by housing, unemployment, transphobia, racism, violence, lack of health insurance, provider education, and legalized discrimination. Next slide, please. And we're winding it down, folks. Don't assume anyone's gender or which pronouns they may use, okay? Don't ask someone what their real name or their dead name is. Don't do it. A person's personal gender pronouns can change. If you're not sure which pronoun a person is using, always okay to ask why. Next slide, please. And this one just says, if you're trying to attract local trans people, make sure you use them as part of any marketing campaign that you may come up with. And pay them. Let me repeat this. Pay them. I mean, we all love having volunteers, but if you really want a quality product, you pay for what you get. So pay them. And one more caveat. I just wanted to say, like the photo at the top on your top left, that's a campaign that we did, which is called Status is Everything. And it was a campaign that we did in 2010, 2011. And as you can see from that poster, we had 2 trans women on that campaign, as part of that campaign. And we had billboards, we had sides of buses, we had bus stops and things like that. And really in Newark, they did not know that these were all gay people. I mean, it was a testing campaign. So they really did not know that these were trans women and or gay men. They just thought they were, African-American young people. So testing actually went up for a bit in the entire city of Newark, not just within our population. And the one below that's one of our original, I don't think she was actually a Ginger Girls, but she was just one of the models that we used, a trans model. Her name is Starlee, and she's now working in New York City. She has her own eyelash company that she does now. So we just saw her grow up from a cute little teenage boy. Now she's just a stunning trans woman. And in the final photo, that person in the purple head scarf thing is another former employee who was gender nonconforming. And so we had to make sure that we were using the correct pronouns, which was they, them, theirs. So, it kind of got difficult in my office for a while because I had more trans people and gender nonconforming people than I had, just plain old black gay men. So, pronouns were flying all over the damn place. So it was a fun time. So, and I just want to take this opportunity to say, listen, there is a caveat because when you hire somebody who's trans, who hasn't been in this field for a while, the field of HIV education, they learn a lot, they see a lot, they grow a lot, and they develop these mad skills, and they're suddenly more marketable, and then they get jobs somewhere else. I gotta tell you, it's happened to me more than once, and you know what? You have to let it go. When people, when caterpillars, get their wings, you have to let them go. It's like the old saying says, if you love somebody, set them free. I know when the first time it happened to me, I got very, very pissed off, and I gave the agency that this person went to a hard time for a little while, and I do apologize. But I learned that progress is progress, and you cannot stand in anybody's way. If one of the things you're doing is trying to help empower this whole group of people, trans men, trans women, let them be empowered, and if they need to go, let them go, okay? And I believe that's all I have for now. I mean, there's some publications and on the next slide and some handouts I think we're getting. But I think that'll do it for this presentation. Thank you. I appreciate y'all listening, and we're ready for your questions.
Yes, and so thank you so much, Gary Paul. Those were some great examples of some materials. You provided a lot of important information. It was great to listen to the evolution of your services for transgender persons and how far AAOGC has come. And then also, when we did get some comments, it was also very useful to hear your recommendations for best practices, which is something that I'm sure many people were looking forward to listening. And so with the presentation that everyone will be able to download the presentation immediately after the session ends, you will have all of this information in there. And but I just want to, and I realize that we are past time. It is 3:21, and so we will not take offense at all if you have to step away and continue on with your day and go to the next thing. We totally understand, but we're going to hold on here for just 1 second for those of you who do have the extra time, and we still want to be able to address a couple of questions. And I hope that, Gary Paul, you and Ariana, and I'm going to open up Ariana's line, can also just stay on and answer a couple of questions before we definitely close it out. So is that okay with everybody?
It's fine with me.
Okay, Ariana, are you there? I just opened your line. Thank you so much. Okay, so I'm gonna go back. I'm gonna backtrack a little bit because in the chat, in the comment box, we did get a couple of questions, and so we're gonna go ahead and I'm gonna backtrack a little bit so that we can get to some of those questions. But actually, I do have one. So there were a couple of comments related to, just more information needed about transgender men. So this question can go to either you, Gary Paul, or to Ariana. So what differences between transgender men and transgender women exist that organizations should consider regarding competence and quality care in their programming? So what things should be considered when organizations want to create more competent services and more competent care and programming between transgender men and transgender women?
Well, it's very interesting that question was asked because right now I do not have a trans woman on staff because my last one went to work with another agency. But now I have a trans man on staff, which is the first time we've actually hired a trans man. So we're basically going to be trying to do what we did with our trans women population with trans men. They are so totally different. I mean, it's not just a gender difference or a transgender difference. For instance, there are some trans men who like sleeping with women, and there are some trans men who identify as gay and only sleep with men. That difference in of itself means you really need to do your homework and find out what you want to present out there. It's like when we do not have a lesbian population per se in our agency, and we didn't have trans men outreach at all because we figured we were like gonna bite off too much that we could chew. But now that we have firmly established the trans women outreach and stuff that we do, we can let some of that go and work with some and collaborate, like Ariana said, collaborate with some other agencies. But now I think we need to bring forward some topics and things, services for trans men. So that was a very good question. Thank you.
Okay. So we have another question, and I'm going to paraphrase it a little bit. It says, what percent, I'm thinking this person, the person's name is Tanya Archie, what percent of, I assume they're asking about the LGBT population is transgender and not specifically HIV positive? So what percent of the LGBTQ population would you say is transgender?
Go ahead, Ariana.
no, I don't say nothing. But anyway, the I think the data for transgender individual is very important. We are like yesterday in the Supreme Court, right? They say from the $8 million or 8 million people who is employing LGBT employee in United States, 1 million is transgender. But for me as a transgender person is like a little difficult because I don't see many transgender working. So the data is very important and we don't know, and that is very important also to transgender have a voice or any type of accountability in the census, because we are not present in the census, so we cannot have if you can see in the last 3 or 4 years, transgender population is the most population who they reproduce the numbers right out, so fast. So I think it's very important to get the data. And we don't know because also many transgender they don't be part of the LGBT community. And
Mm-hmm.
yes,
That's one
around
thing that I
one
was
point
wondering as well.
yes, around 1.4 million Americans defined as transgender non-conforming people.
Yeah, and I think that
Thank you.
number is
Thank
is
you.
very very fluid because when you think about it, when we started our agency, you never heard of gender nonconforming or any of that. I mean, so the more people get empowered to be who they are, the more they're writing their own narratives and defining things for themselves. So I think that's a fluid, very fluid number. I think a lot of trans men may be stealth and they don't, once they've had surgeries and things like that, maybe they don't want to be part of the community, or maybe
Mm-hmm.
they don't want to identify as part of the community. But yet,
Right.
you know, but yeah, but a lot, on the other hand, a lot of them are advocates for gender identities and things like that. So that's a tough question to answer, since there really isn't one scientific based study that actually can answer that question, in my opinion.
Yes, thank you, Gary Paul. And since you mentioned it, I'm not sure if our participants understand or are familiar with the word stealth. Can you quickly describe that?
I'm sorry, with the word. Oh,
Stealth.
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 A lot of and a lot of trans men, once they make their transition, they may settle down. They may settle down with a woman, heterosexual, and live a heterosexual lifestyle. And that's to say, who's to say if that's good or bad? But stealth is like, the stealth bomber. You can't really see it, or they kind of go undercover. But and it's not a bad thing. It's just how they choose to live their lives. You know what I mean? So we just have to be, recognize the fact that everybody makes their own choices and they live their own life the best way they can. So we can't be judgmental.
Yes, we have to be very non-judgmental and respectful of that. Yes. So someone asked, any tips for helping transgender people quit smoking? That's a tough one.
Well, personally, I actually quit smoking cigarettes 30 years ago, and it was actually the very week I met my husband 30 years ago. But it was a group hypnotism for me. I was working at Gay Men's Health Crisis, GMHC at the time, and we did this group hypnotizing thingy, and it worked for me. So, but I'm telling you, it's tough for a lot of people. I know a lot of people who quit, on a monthly basis. So. That's a tough one.
Ariana, would you think that in that situation that similar practices would apply, that would be used across the board for any person, or there should be some very specific strategies to use with transgender persons who are transgender?
For smoking transgender people?
Right. Yeah.
Yeah, well, as a client, and as a former smoker person, was was treated by Chantix when my doctor. I know some other people they have they have other situation. But I think more in my career, that is personal, of course, right? But in the community, what I think is necessary, correct, healthy relations and healthy mental health for transgender, detox program and rehab programs. That is what we need specific at the transgender community, and specific for the youth population, for those who they want to reach, those people who is 18 to 27 and they are right now in different smokers and everything, because for transgender who they are past, the expectancy of life in United States for transgender individual is 30 years old. I'm 48. So I'm a warrior, and many of the transgender in my age, they living, we know that. And we trying to be very specific. I know that is the most, the age of the population, of the transgender population. You can work better and give those resources to quicker smoke and everything easily. But for the youth population, we need a more mental health and rehab other programs for transgender individuals.
Thank you so much. Thank you so much. It's really important to hear that specific services for transgender people, it creates that safe space where they can actually really open up and their issues can be heard and they feel more comfortable speaking, is what I'm hearing from you and from the both of you. I do realize the time, and I still want to be respectful. I want to thank you so much, Ms. Ariana Lint and Mr. Gary Paul Wright, and to all of you who participated in today's session and are still with us, listening. I just want to give Ariana and Gary Paul just the one final opportunity to make a closing remark, and then we're gonna close it out, because I know it's already way past the time we said we would keep you all. So, Gary Paul, do you have a closing remark?
If you're not working with the trans population right now, I would say if you have, a population in your city, your town, wherever you are, you really need to invite somebody trans to be on your cab or on your board of directors or something like that. But just be trans friendly, and if you open up your doors to that community, they will come in and they will really, really appreciate that people really care about their health, because that's what it's all about. They get, stricken down so many times, on a daily basis. Having a safe space is really, really important, and I wish you all, great luck in doing that. So thank you for letting me be part of your afternoon.
Thank you, Ariana. Do you have any closing remarks?
Yes, of course. And first of all, thank you so much to the people who they are organize this training. I'm very happy and I'm very comfortable provide this training, and also for as a transgender woman living with HIV, and don't having a lot of people know, a lot of people is in the other side. They are case managers, nurses, people who they working, help me to driving and thriving, and in my life, and my personal life is very touching. I'm very happy, I'm humble to give this kind of training to all those kind of, you can change life for many people, especially for transgender. And if you change the life for one transgender, you don't know how impact you can make in those persons. And yes, I want to finish when, yes, if you can close your eyes, because I'm very, very always make like that. You can close your eyes and remember, specific, I am in Puerto Rico right now, so it's so hard, and you're working, and you just want to go to your house and go to that specific space in your house where you can see that picture who they change everything bad in your day, that picture of your graduation, that picture of your when you get married, that picture of your kids, that picture of your family, that picture, they change your mood instantly, no matter what. For many of transgender individuals, we don't have that picture in the house. We don't have picture of graduation. We don't have picture maybe with family, or we don't have picture, just to be us. So it's very important to give the opportunity to a transgender individual, and just you can feel in and you can do something for the transgender community. And thank you so much, and see you next week.
Thank you so much, Ariana and Gary Paul. Again, I just want to. I really wish we had more time that we could ask more questions, because I know that many of the participants had more questions. But I want to take this opportunity to promote the next session, which is next week on the 23rd. It's called Ask the Experts: Transgender Competence and Quality Care. Mr. Gary Paul Wright and Ms. Ariana Lynch will also be participating in next week's session. Also joining the panel of experts will be Mr. Sean Coleman and Mr. J.T. Perez, who are both transgender men. And we will have more of an opportunity to get your questions answered. Everyone will be doing a very short, brief presentation, and then it will be all about answering and responding to questions and comments. So we really hope that you have registered. If you have not registered, there is some limited space available. But I just want to be clear that for next week's session, you would have had to register separately. So if you think you're registered and not sure, we want to encourage you to go ahead and click on the link so that you can register, and so that you will be able to get your questions answered and you won't miss next week's session. But again, thank you so much. You will be receiving a really quick evaluation form once the session closes. And if you have any more questions for us, or would like to learn more about capacity building assistance or technical assistance in this topic or other topics, you can reach out to me. And I did have I've been moving around. This is my email address. You can contact me and we can discuss that. We have been doing some virtual office hours where we've been talking to organizations about their needs. So you can join one of those sessions, and those are private one-on-one sessions. So I don't want to hold you any longer. Again, thank you to our speakers, and thank you to all of you. There are resources available, and in a previous slide, there were resources that were clickable. And here are some of the references and resources. So thank you again. And with this, I will end today's session, but I hope that all of you will join us next week for next week's session as well. Thank you, Joanna DeBow, for handling the chat box and the comment box, and to all of you for hanging in there. I will see you soon, and enjoy the rest of your day. Take care.
Bye.
Bye. Bye, Ariana. Bye, Gary Paul.
Bye-bye. Bye. Thank you.